Good afternoon. I'm joined today by Dr. Vinda Walker, NHS England's Regional Medical Director for London, and by Martin Hewitt, Chair of the National Police Chiefs Council. As you know, we remained locked in a fight against coronavirus. The pandemic has occupied our lives for many months, and we are now grappling with the emergence of a new and more infectious strain. We are therefore asking you to stay at home, to protect the NHS and save lives while we work hard to roll out the vaccine as quickly as possible. As of today, 2,431,648 people have been vaccinated across the United Kingdom. Today, 45,533 people have tested positive for coronavirus. As of the 10th of January, 35,075 people are currently in hospital with coronavirus. That is an increase of 22% from this time last week. And sadly, of those who have tested positive for coronavirus across all settings, 83,203 people have died. 1,243 fatalities were reported yesterday. My thoughts and prayers are with the families of those who have lost their loved ones to coronavirus. These numbers are horrifying, and they underline why it is absolutely critical that everyone plays their part and follows the rules. We know that most of the public are doing exactly that. They are doing the right thing and they are staying at home. And I want to say thank you to the millions of people who are putting our country's collective health first. To everyone who has put off seeing their parents, grandparents, their loved ones, their vulnerable loved ones, thank you. You have helped to stop the spread of the virus and save lives. Our ability to get through the coming weeks and months depends on each and every one of us contributing to what is truly a national effort. But a minority of people are putting the health of the nation at risk by not following the rules. That is why the Secretary of State for Local Government has today talked to councils about the role that they have to play in enforcing the rules and in saving lives. And our police officers are now moving more quickly to issuing the fines where people are clearly breaching coronavirus regulations. Nearly 45,000 fixed penalty notices have been issued across the United Kingdom. So my message today to anyone refusing to do the right thing is simple. If you do not play your part, our selfless police officers who are out there risking their own lives every day to keep us safe, they will enforce the regulations. And I will back them to do so, to protect our NHS and to save lives. Our police officers are not immune from the virus. Far too often they're having to risk their own lives and their own health by coming into close contact with people, including those who deny the very existence of coronavirus, to keep us all safe. The police and fire service staff throughout this pandemic have been on the front line, helping their local communities. They are the very best of us all, and I know that the public share my gratitude for their incredible contribution. They're also there to help the most in need, including anyone experienced or at risk of domestic abuse. You can leave your home to escape harm and seek refuge, and anyone who is in immediate danger should always call 999. We are now at a critical stage in our battle against this virus. To protect those that you care about and the capacity of our hospitals to protect us all, please stay at home to protect the NHS and save lives. I'll now hand over to Martin Hewitt, the Chair of the National Police Chief Council. Martin.
Thank you, Home Secretary. For the last 10 months, police officers, staff and volunteers across the UK have been out policing their communities. They've been doing their normal role of keeping people safe and fighting crime, but they've also been playing their part in defeating coronavirus by ensuring compliance with the various restrictions that we've all been living with. From the outset, we did this in the way that we always police, working with the public and using common sense and discretion, In most of our daily encounters, it's been enough to engage with people, to explain the rules and to encourage compliance. The majority of the public have worked with us, and I thank them for that. But a stubborn number of people have refused to abide by the regulations, and we have had to use enforcement powers. Up to this point, as the Home Secretary has said, across the whole of the United Kingdom, we've issued almost 45,000 fixed penalty notices, and for that, I make no apology. It's very clear that we're now at the most dangerous stage of the pandemic. There is a real and present risk that our health service could be overwhelmed and people, our friends and family, could die needlessly from this virus. So we must all play our part in stopping that from happening. 10 months on, the rules are clear, and I urge everyone to abide by them. With a virus spreading so rapidly through contact with others, we should all be asking ourselves whether our reason to leave home is truly essential. Those personal decisions are critical. Since October, we've been guiding our officers to move more quickly to issuing a fine where people are clearly breaching regulations and they're not listening to us. And in most cases, the person will comply after one request. But there are still too many who are choosing not to, and in doing so, they're endangering us all. And so it's important for me to be really clear. At this critical time, we will have more officers out on dedicated patrols to take action against the small few who are letting us all down. And let's remember, each of those officers is putting themselves at risk in order to keep people safe and to slow the spread of this disease. And that's why it's so disappointing to see some of the irresponsible behaviour that we are having to deal with. And let me give just a few recent examples. A boat party in Hertfordshire with more than 40 people who'd paid £30 each for a ticket. A minibus full of people from different households travelling from Cheltenham into Wales to go for a walk. And in Surrey, we issued a £10,000 fine to the organiser of a party who was trying to claim that it was a business event. And we're also preventing dangerous breaches. In Bristol at the weekend, we arrested a 19-year-old man after finding an advert for an illegal rave on social media. Avon and Somerset Police prevented that event from starting, issued fines to 38 other people who showed up, and turned away many more. We will not waste time trying to reason with people like this who have no regard for the safety of others. Organising parties or large gatherings is dangerous, selfish, and totally irresponsible in light of the current threat that we face. Organisers will be fined, but so too will the people who choose to attend. Not wearing a face covering on a bus or a train is dangerous. It risks the lives of other travellers, including those critical workers who must continue to use public transport to do their important work. So on those systems, unless you're exempt, you can expect a fine. The police service across the UK is doing all it can to support the many, many people who are making daily sacrifices to protect the health of their family, friends, and communities. And as more people act sensibly and stay at home, we will still be visible on your streets and continuing the work that we've been doing throughout the pandemic to keep you safe. Our successful staged enforcement approach remains, but we will not linger on encouragement for those who are choosing to break the rules. The rules are clear, and we need to abide by them if we are going to protect the NHS and save people's lives.
Thank you, Martin. Dr. Walker.
Thank you, Home Secretary, and good afternoon. My name's Vinda Walker, and I'm the NHS England Medical Director in London. Before the questions begin, I'd like to start by thanking all of my colleagues in the NHS, in local government, in the London Fire Brigade, and in the Metropolitan Police for the support and their hard work during the course of this pandemic. This pandemic is the biggest health emergency this country has faced since the Second World War. For the last few weeks, through the Christmas period and right through the start of the new year, we have been facing three substantial challenges. At the start of November, NHS hospitals in London were caring for 1,000 patients with COVID-19. On Christmas Day, that had increased fourfold to 4,000. And today, that number has nearly doubled to just under 8,000. And more than 1,000 of those are on critical care, the sickest patients. And I'm grateful to colleagues in other parts of the country who have been caring for some of our patients who have come from London. At the same time as London continues to care for patients with COVID-19, we care for nearly 3 times that number of patients without COVID, but other conditions such as cancer, heart attacks, and strokes. And our plans to surge the bed capacity in London means that it is important that we continue to care for the most ill COVID-19 patients, but also other urgent and emergency conditions. But as the pressure from COVID-19 has increased, this has put pressure on the number of beds that we have for other conditions. That's why yesterday we opened the Nightingale Hospital and admitted our first patients. This time it's taking patients who do not have COVID, and this means that our hospitals have more beds to care for COVID patients themselves and for our very sickest patients. But we cannot do this indefinitely. There comes a point where if the infection gets further out of control, more and more patients from London will need to be transferred elsewhere. And all across the country, my colleagues are also seeing a rise in infections and in pressure on the NHS. And so my ask today is to obey the government rules for another reason, as well as the ones described by the Home Secretary. There is hope. Whilst in one hall of the Excel Centre in London, we have opened the Nightingale, in another hall, we have opened London's first vaccination centre. We're working with 102 local vaccine services and 39 hospital hubs. And in London, the NHS has now vaccinated hundreds of thousands of people, the majority of them over 80. I'm a doctor myself, and I've been on an intensive care unit in East London today. And I can tell you, COVID-19 is a horrible, horrible disease that leaves so many, including young people, breathless and gasping for life. It places increasing pressure on the NHS, so please follow the rules and act like you have COVID. That will save lives, and it will help my fellow doctors, nurses, paramedics, physiotherapists, and many other health professions to do what we're here to do and to serve you best, which is to care for the sickest. Thank you.
Thank you, Dr. De Walker. Should we move to our questions? I think our first question this afternoon is from Ian from Preston.
Hi. If the new COVID variant is more infectious than it was last March, why are the new COVID rules more relaxed?
Well, Ian, thank you. Let me start off with that first of all, and then I'll bring Martin and Dr. De Walker in. I think it's really important to reflect, quite frankly, on the state that we're in right now. And you've heard my remarks, Martin, and Dr. De Walker's comments about the impact of COVID, and not just this new variant, but actually all the measures that we have put in place and why we need to have these rules. I think our message is absolutely crystal clear. This is to stay at home. And if I may, Dr. De Walker's made a very, very sobering point that we should all act like we have COVID in order to protect others. And this isn't about rules being more relaxed. We have clear rules. And I would urge everybody across the country to make sure that we follow those rules so that we can protect the NHS and save lives. I think that's absolutely imperative. Dr. De Walker, did you want to add anything to that?
No, thank you, Home Secretary.
Great. Martin?
No, the only thing I would say, I think, is that the rules, it is fairly simple. The basic things that we need to do to prevent the spread of the virus, which is prevent that contact with people. So that's staying at home and only leaving your home if it's one of the exemptions and it's absolutely essential. If everybody does that, then I think we're in the strongest position to restrict the transmission of the disease.
Thanks, Martin. We'll move on to Diane from York.
Good afternoon. When will the vaccination programme prioritise key workers who are in contact with the public every day, but not health and social care, such as police officers, teachers and supermarket staff? Thank you.
Diane, thank you for your question. And it's a really important question, actually, about prioritisation and the groups that are being prioritised right now and focused on. Dr. DeWalker's already mentioned the Excel Centre, which is doing great work in terms of the vaccination and getting the vaccine out. But effectively, we do have the JCVI, which has already identified the top priority groups who account for 88% of those who are affected by COVID and sadly could also be at risk of dying. So there are the 4 priority groups right now, and we intend to vaccine everyone within those cohorts between now and the 15th of February. I should also add that the JVCI, and we're all working with them across government to give everybody this assurance, we are looking at those who are on the front line, people such as police officers, teachers and others who naturally are at occupational risk of coming in contact with the virus. You've all heard me speak today, and Martin, about police officers, fire officers. There are many others on the front line, and we are absolutely working to make sure that, of course, we can get the vaccine to them, but that means working with the JCVI as well. Dr. DeWalker, do you want to comment at all on the vaccine rollout?
Thank you, Home Secretary. So I completely agree with what you say. I think what I've said from my comments earlier shows how serious this illness is. Our number one priority has to be to prevent death and to prevent serious illness. I know from colleagues on the Joint Committee for Vaccinations and Infections, they have thought carefully about this and used the evidence to show that if we vaccinate the priority groups of people that the Home Secretary's talked about, we will be able to reduce the chance that people die. And that is what will get us out of this situation that we're in at the moment. And I think that is absolutely the right strategy to take.
Thank you. Martin.
Yes, and I think it's a really good question by Diane, and I would obviously support for all of those key workers who are having contact every day. But I think it is really important to make the point about what police officers have been doing. I started by saying that for the last 10 months, police officers, police staff, volunteers have been out there. And of course, the nature of policing is that those officers are having daily to deal with people where they have no idea whether they are or are not infected. We've worked really well in terms of providing protective equipment and having good systems in place. But as one of my chief constable colleagues described, you can't police at 2 meters distance. We have to do the job to protect people, to deal with the crime that we've been dealing with. So it is really important that as soon as that first phase of the vaccine is over and has been completed, I think a range of key workers, I know that's happening in government, and that is conversations that I and others have personally had with government. But it is a really important point that Diane makes.
Thank you, Martin. We're going to move on to questions from the media, and we're going to go first of all to Mark Easton from the BBC. Mark, good afternoon.
Good afternoon. Thank you. And a question for you, Home Secretary. Home Secretary, we're warned we may be facing a health service catastrophe. So why are the rules of this lockdown not as tough as they were last spring?
Well, I think, Mark, first of all, if I may, you're right. We are speaking consistently and constantly, day in, day out, about staying at home. And we're very clear in the reasons as to why. You've all heard us say this, and others across government, CMO, and many others, about the impacts on the NHS. The rules are actually very simple and clear. We are meant to stay at home and only leave home for a very, very limited number of reasons. And that is obviously to go to work only if you cannot work from home. In terms of schools are open for the children, pupils of key workers. And then, of course, outdoor recreation, but in a very, very restricted and limited way, staying local. I've said that several times over the last week. And obviously people that need medical help and support. And you've heard me speak frequently as well about those that could suffer from violence, domestic abuse, etc. These are very, very limited reasons for leaving. And I think, I can only actually echo the words of Dr. DeWalker. We are in a health pandemic right now. everyone has to be conscientious in their actions and almost act and behave as if we have COVID, therefore restricting all our social contacts. So the rules are clear. And in terms of police enforcement, we've spoken at length, not just today, but previously, Martin and all my brilliant colleagues across policing, as to the type of egregious breaches that we will clamp down on. So the rules are clear. Martin, do you want to add anything to that at all?
No, I think it is really just to make that point that the stay at home, the reducing contact, I think that is very clear. And certainly from our perspective, we will carry on engaging with people. That's how we have done this from the beginning. We will talk to people and we will explain. But I think the rules are clear enough for people to understand. We are 10 months into this process. And you're right that the regulations have shifted over that period of time as the pandemic has. But I think it's very clear what people need to do, and people need to accept the personal responsibility to act properly to prevent the spread of the virus.
Thank you, Mark. We're going to move on to Dan Hewitt from ITV. Dan, good afternoon.
Good afternoon, Home Secretary. You say the rules are clear. The key question surely is, are the rules tough enough to contain the current spread? And question to Martin Hewitt, if I may, there is no designated limit on how far we can travel for daily exercise. Surrey Police and Crime Commissioner David Munro told Times Radio earlier, the fact we're having to debate whether the Prime Minister broke the rules or not when he took that 7-mile bike ride is proof we need more clarity about them. Do you think more clarity is needed on the rules?
I think, Dan, there's been a lot of focus today about the definition of local. And I think actually, if you tried to make a definition for every possible circumstance, that would be really challenging. And I don't think we're in a position where we want to set a particular distance, because if a police officer stopped somebody, how would you prove that a person is within or outside that distance? I think it's simpler than that. There is an exemption, and let's take exercise. There is an exemption that allows you to exercise, and I think that's absolutely right for people's physical and mental health. And I think you have to ask yourself 2 questions. If there is an exemption, the first question is me going out and doing this today essential? And if the answer to that question is yes, then you have to ask yourself, how can I conduct this exercise in the safest way possible? And by that means not putting yourself into a position where you're likely to come into contact with people. So I understand why the issue of local has become quite totemic, but I think it's the wrong question to ask. That we all understand the exemptions. Ask yourself whether it's essential, and then do it in the safest possible way that you can.
Dan, just to add, I absolutely agree with Martin's comments. Look, we are in a pandemic. The British public are absolutely sensible. They're conscientious. They understand the stay-at-home message. And when it comes to staying at home, that also means staying local. And that equally applies to, exercise is important. It's important for people's health and well-being. And that equally applies to exercise. Thank you.
On the question, are the rules tough enough? Sorry, you said the rules are clear. Are the rules tough enough to contain the current variant?
Well, first of all, the rules are clear. The rules are firm in terms of staying at home. And with that, of course, Dan, I think you've been showing some news bulletins recently of breaches that have been taking place, and you've been out with the police and others. So you'll know the difference between those individuals that have been compliant and those that are breaking the rules. The rules are tough enough. You've already heard 45,000 fixed penalty notices that have been issued, just in the recent time since we've been in this pandemic. So they are tough enough. The message is clear. We urge everybody to continue to follow the rules. The more we follow the rules, the sooner we can drive this awful, atrocious disease down. And the reason why we have these rules are to absolutely try and contain the pandemic and to save lives. So, by sticking with this, and that is the message to everyone again and again, stick with the rules, think about your actions, stay at home, stay local, and minimize your social contact. And of course, we will get on top of this pandemic. And importantly, we'll be able to protect the NHS so that the NHS can continue to look after people that are ill with coronavirus, and also roll out the vaccine in the way in which we're now seeing this incredible mass vaccination take place across the NHS. Thanks, Dan. We'll move on to Sam Coates from Sky News. Sam, good afternoon.
Good afternoon, Home Secretary. Is there a risk that the government is concentrating too much on the easy targets, people meeting in parks, parties and shops, when the evidence suggests the real problem is in those workplaces that remain open and on public transport? Have you got the resources and, frankly, the will to enforce social distancing in and around workplaces, or are you unwilling to take on bosses because of the economic impact? And to Martin Hewitt, how proactively are the police making sure that workplaces are COVID secure? And or do you just think that's the job of the health and safety officials in local areas, so that you can concentrate on more of the examples you highlight, like parties and groups travelling in minibuses?
Well, let me start off, Sam, first of all. When it comes to the rules, the fact of the matter is our targets and our objectives is to save lives. This isn't about, picking out individual groups or things of that nature. You've heard the government consistently say this, from the CMO to our public health colleagues, Dr. Dworka this afternoon, and many others as well, from the Prime Minister to myself and all my ministerial colleagues. Our objectives is to save lives and to protect the NHS. So when it comes to the enforcement of those rules, it is right that we go after those breaches, and we've seen endless egregious breaches. And I've seen my police officers as well, all our police officers across 43 police forces do heroic work on that. But at the same time, this isn't just for the police. This is obviously about other aspects of government. So my colleagues, you've heard me speak about the Secretary of State for Local Government today, working with local councils. The police don't work in isolation. They work with their counterparts in local governments, local authorities. They've been doing that consistently. We have clear guidance for businesses, clear guidance for supermarkets. And I want to thank the supermarkets today that have announced that they're stepping up their efforts as well to ensure that people are rightly wearing face coverings in supermarkets, and they themselves will be enforcing those rules and regulations. So this is a collective effort. And, we have been speaking clearly about the policing side of things today, but there are so many other aspects of enforcement and compliance that other aspects of the state and government are heavily involved in. Martin.
Sam, thank you. So let's be really clear. The primary operating environment for policing in this is in the public space and dealing with those issues that I've described and you've described. The workplace, we obviously have worked really hard to manage all of our own workplaces for every force across the UK and making those COVID secure. And that is ultimately the responsibility of any business or owner in that space. But as the Home Secretary says, what's also happening across the country, every police force is working at a local level with all the other agencies that have responsibilities for making sure that the community is safe. And that will include working with local authorities and all the other authorities that have a role within businesses. But primarily, our space is the public space, and that's the important place for policing to focus its attention.
Thanks, Martin. Thank you, Sam. I'll now move on to Gordon Rayner from The Telegraph. Gordon, good afternoon.
Good afternoon, Home Secretary. Thank you. A question for Dr. Dworka. When you look at experiences of your colleagues in Europe, where hospitals in France and Italy were able to cope with almost 40,000 patients in November without telling people to stay at home, is there more the NHS could have done to prepare for this winter crisis? And just a question to you, Home Secretary. We know that various discussions are taking place within government about tightening the rules, as a couple of the other people have already asked about today. At what point will you take the decision on whether the rules do need to be tightened? Is it only a matter of time before that happens? And if that's the case, are you just delaying the inevitable by not taking a decision now?
Thank you, Gordon. I'll go to Dr. Dworka first.
Thank you. Well, over the summer, we, of course, spent a lot of time learning from the first wave of the pandemic, picking out the things that we did that had made a huge difference to the way in which we managed that first part, and also learning about things that we might do differently. One of the things that we did was that we invested in more critical care capacity in the NHS in London. But over the last few weeks, as I said in my opening comments, the pandemic has progressed extremely quickly. And it's thanks to the efforts of my colleagues in the NHS who've really gone to extraordinary efforts over the last 2 or 3 weeks that we have opened hundreds of beds, and I mean hundreds of beds, in not just the Nightingale, but in all of our hospitals to be able to manage that. And it's because we are part of a national health service that we have also been able to work with my colleagues that I'm very grateful to in other parts of the country to make sure that where the NHS in London hasn't had the capacity, that we have been able to move patients safely to other hospitals elsewhere in the NHS. And it's by working together in partnership that I think the NHS has been able to manage an extremely challenging and difficult situation.
Thank you. Gordon, to your question about tightening the rules, I mean, as you would expect, in government, there are endless discussions taking place about, the state of coronavirus, support and capacity within the NHS, and also lockdown measures right now and rules per se. Now, we're not going to speculate on anything. Conversations always, these issues are live within government, and rules and ways of working are always under review. So, we are constantly right now looking at where we are at. Sadly, you've seen the fact that too many people are still succumbing to this dreadful virus. And the fact of the matter is right now, we want people to very much, follow the rules that are in place right now, because by following those rules, that is effectively how we can collectively whack this virus down, get this virus down, free up capacity in the NHS, and obviously do even more when it comes to rolling out the vaccine. So, as I've said, all rules are under review constantly within government, but currently we're focusing very much on the compliance enforcement so that we can absolutely support the NHS and save lives. Thank you. I will now go on to Rajiv Syal from The Guardian. Rajiv, good afternoon.
Good afternoon. This is a question for you, Home Secretary. How do you expect the public to understand what constitutes staying local when Derbyshire police tried to fine 2 women for driving 5 miles for a walk, and then 2 days later, the Prime Minister travels 7 miles to go on a bike ride?
Well, Rajiv, as you will appreciate and understand, that when it comes to our outstanding police officers, they exercise their professional judgment constantly, and they have been, as Martin has said, since day one of this pandemic, through the regulations, through the guidance that comes out through MPCC and through the College of Policing. Now, obviously, in the case of Derbyshire, the local police force reviewed that entire case, and they looked at it, and the fine was actually rescinded. But look, I think we have to come back to the current state of play and the situation that we are in right now. The fact of the matter is we are in a pandemic, we're in a health pandemic. You have already heard me say the number of people that have passed away, died, 1,243 fatalities reported today. When we have people dying, when we have people tragically succumbing to this virus, we all have to exercise our judgment and be very conscientious as to how we act. When it comes to exercising, again, I do say stay local. Staying local is absolutely crucial. By all means, take your daily exercise, but it's up to all of us in the right way to exercise that judgment as to how we do it, not socializing, making sure that we're acting in the right way, staying away from other people, which is clearly what the Prime Minister did when he was taking his daily exercise. And I think, quite frankly, we all have to ask ourselves, what can we do to keep everyone safe and absolutely reduce our contact with each other? Martin.
I think, Rajiv, all I would add on the Derbyshire incident, particularly, as you will know, that was reviewed by the force, and the decision was taken to rescind those fixed penalty notices. And it's an important point because it became a big story, and over the last 10 months, there have been a handful of stories that have become quite iconic. I think the important point to make is from the service point of view, this is unprecedented territory. We are dealing with regulations that are health regulations, highly unusual. And I think the police service has stepped up really well to deal with that. There have on occasions been issues where we've made a decision that it turns out the officer's decision was not the right decision. We have always reviewed those. We have dealt with those issues. We have dealt with the individuals involved. I think it would be impossible to imagine that we could be dealing with such an extraordinary experience for everybody over the last 10 months, and all the hundreds of thousands of interactions that police officers are having with members of the public across the UK. So sometimes mistakes will be made, but we always have looked at those. We've looked at them quickly. We've dealt with the individuals, the members of the public concerned, and we have said when we've got something wrong. And I think that's been a really important part of how we've dealt with this really difficult 10 months and undoubtedly for some time to come.
Thank you, Rajiv. We'll move to Alan Tolhurst from Politics Home. Alan, good afternoon.
Good afternoon, Home Secretary. I wanted to ask about the vaccination centres that have opened this week. There's been some concern they may not be properly ventilated. The government's own SAGE subcommittee has warned enhanced mitigation measures are needed to deal with the new COVID variant. The government says they are COVID secure, but what exactly does it actually mean? Can you give some examples of what measures are being taken? And what can you say to reassure the over 80s and the vulnerable that they are safe to go to? The government's own vaccination plan states the role of volunteers is to sit with people in reception and help elderly and disabled people out of their cars. You know, is that COVID secure? We've already seen a vaccination centre in Cardiff have to pause the rollout due to an outbreak of coronavirus cases. So will staff and volunteers at these centres be prioritised for vaccination as well?
Right, well, thank you for your question. I think, first of all, yesterday the government published its vaccine delivery plan, and you've all heard about the big vaccine centres in particular, and the number of people that we're concentrating on in terms of getting the vaccine to. These vaccination sites, you would have seen the pictures, I think many members of the public have as well, have seen how cubicles are spaced out. And obviously we're working with Public Health England and following all the guidance in terms of the safety and protective measures that are required for the staff in those centres, but also for the individuals coming in for the immunisation. So if I can just go to Dr. DeWalker, because obviously we've been speaking about the Excel Centre, which is a good example of how this is all coming together.
Yes, thank you. So I visited the Excel last week before it opened, and being at a vaccine centre actually just this morning. And I think we have absolutely rigid standards of infection prevention control in all of these vaccine centres. I think NHS staff, for them, they see their colleagues who are working on critical care and in general and acute wards, and they know the pressure that they're working under. They don't want to inadvertently pass the infection on to other people. When you go there, you will see, as the Home Secretary says, very strict rules about size of cubicles, the distances that have to be maintained. There's gel everywhere, people are wearing masks, and people are paying a great deal of attention to how these centres are set up. We've spent months preparing to set these centres up, and we're guided by really strict rules about the way in which they should be configured in order to prevent just the sorts of thing you're talking about.
Thank you, Dr. DeWalker. Alan, thank you very much. Thank you.